Well, there are more nurses working in our NHS now than was the case when this government took office by a considerable number. But of course, as I've said many times before in this chamber, we are committed to working not just with the RCN but with the BMA and all other professional groups to make sure that together we are investing in the health service, but as well as investing in the health service, continuing to make the reforms that enable and equip our health service to meet the challenges of the future. In terms of nurses, as the member may be aware, I yesterday visited Napier University to meet with student nurses, where we were confirming an increase in the number of student nurses, but also the protection of the bursary, unlike in other parts of the UK, and £3 million of additional support for student nurses who have children or other dependents to make it easier for them to pursue the fantastic career of nursing.
Ruth Davidson.
I'm aware of the First Minister's visit yesterday, and what's interesting is that the Royal College of Nurses spoke after that visit, after the announcement, and they were specific in what they said, and I'll read it to the First Minister. It is not enough to say that there are more nurses. The question is whether the numbers meet the demand, and the RCN says it doesn't. I think we should ask ourselves why we're in that situation. 6 years ago, as Health Secretary, the First Minister embarked on 2 years' worth of catastrophic cuts to nursing places in Scotland. And she was warned by nursing leaders that these cuts were not sustainable and that they could impact on patient care. And she was warned from across this chamber of the short-sightedness of her approach. And now, as predicted, patients are paying the price as routine operations are cancelled and treatment waiting times grow, all because of staff shortages. So can I ask the First Minister, if she had her time over again, would she still make those cuts to student nursing places?
First Minister.
Well, let me make a few points about that. I well remember that period. There were significant challenges at that time of student nurses being unable to get work. There was a problem of nurse unemployment, and we took decisions, as I think we were right to do, on the basis of the data that was available to us at the time. Second point I would make is an important one, that over the lifetime of this government, there has, I think, on average, been 1,000 more nurses in training each year than was the case in a comparable period under previous governments. In terms of nurses in our National Health Service, the number of qualified nurses and midwives is up by 5%. There are more than 2,000 additional whole-time equivalent nurses, qualified nurses and midwives working in our NHS today. So that is a sign of the commitment of this government to supporting and investing in our National Health Service. But I have been very clear in the past, and will continue to be clear, about two things. Firstly, the need for continued investment. That's why this government was elected on a commitment to increase investment in the health service over this Parliament by £500 million more than inflation, a stronger commitment than that of any other party in this Parliament. But secondly, we have to reform our National Health Service. That's why we have integrated health and social care. That's why we're also committed to getting more money into primary, community and mental health services. And lastly, I would simply say this to Ruth Davidson. Right now she's arguing for a budget where we would give a massive tax cut to the top 10% of income earners in Scotland. I would just ask her to reflect on what that would mean for the health budget if we were to follow the advice of the Tories in this chamber.
Ruth Davidson.
That sounded very much like the First Minister was asking for praise for trying to mop up a mess that her own cuts had made. But let's focus on the real-life impact of what's happened. We were contacted this week by a gentleman called Hugh Faulkner in Inverurie. He was put on an urgent referral for treatment last year and was told that he would receive surgery within 12 weeks. But he's now been informed that Aberdeen Royal Infirmary is no longer able to book his operation and has also stopped referring patients to the Golden Jubilee in Clydebank. He has been told that he will not get the operation that he needs. And this is on the back of reports this week that NHS Grampian, there are operating theatres that are lying empty because hospitals don't have the staff. Now, I know that the First Minister cannot comment on individual cases, but I'd like to remind her of Audit Scotland's findings last year, that after 10 years of this SNP government, it has failed to do the long-term planning to build up a sustainable workforce in the NHS. And they've been at this for a decade. So can the First Minister explain to people like Mr Faulkner, who can't get an operation at the same time as operating theatres are lying empty due to a lack of staff?
First Minister.
Well, I mentioned the increase in qualified nurses and midwives in an earlier answer. Under this government, staffing in total has increased by over 11,500 whole-time equivalents. That takes staffing in our health service now to a record level. NHS Grampian, for example, right now is working to increase its theatre staff. The surgical team at NHS Grampian has just employed 7 newly qualified practitioners. So that is the sign of the commitment we have to staffing within our National Health Service. But we are also committed to going further. That's why, unlike other parties in this chamber, certainly unlike the Conservative Party, we are committed to further additional investment in our National Health Service. I say again, £500 million over and above inflation over the life of this Parliament. And I simply pose again the question that I posed in my last answer to Ruth Davidson, because it is an important question. We're in a budget process right now where we are committed to record investment in our National Health Service. Ruth Davidson wants us instead to cut tax for the top 10% of income earners in Scotland. Now, I do think people have a right to expect some consistency for the Conservatives when they come to this chamber. We are choosing investment in our National Health Service. Ruth Davidson thinks we should choose tax cuts for the wealthiest. Now, she's entitled to prioritise tax cuts for the wealthiest, but she then can't come to this chamber and ask for even more money for the health service. It's time for Ruth Davidson to choose, because I choose investment in the health service.
Ruth Davidson.
We want to grow the tax base to fund our public services. She's damaging our economy. But I'd simply ask the First Minister, if staffing is all fine, why are theatres lying empty and patients not getting the operations they need?